Hi everyone, welcome to the virtual tour of the Physiotherapy Department here at Singapore General Hospital. I'm Cheyenne and I'll be your host for today. Here at SGH, getting patients a step closer to a meaningful recovery is at the heart of what we do. Without further ado, let's meet some of my colleagues who will tell us more about the different services that we provide. Hi Junju, thanks for showing me around.
You're welcome, Cheyenne.
This is your one-stop station to get you prepared for your upcoming surgery. Frail patients scheduled for elective major abdomen and vascular surgeries are introduced to the PAIR program, a tailored set of interventions to optimize physical fitness before surgery. Pre-operative education and home exercise interventions are prescribed for our patients in the ERAS program to facilitate timely discharge after surgeries.
Hi, I'm Dora and welcome to the Amputee Clinic.
We see patients who have undergone a below-knee or above-knee amputation before and after they get their prosthesis. Before getting fitted with a prosthesis, we teach our patients strengthening and balance exercises to prepare them for the demands of being a prosthetic user. Patients who are ready will be taught how to walk with the pneumatic post-amputation mobility aid. This prepares the stump for weight bearing in the future with the actual prosthesis. We work closely with the doctors, prosthetists and orthotists, and social worker in order to help our patients get back on their feet and achieve a better quality of life.
The Rehab Centre also provides services for patients with movement difficulties arising from neurological conditions such as stroke, Parkinson's disease, vestibular issues, and spinal cord injuries. So we're now here at FGym. Let's go meet the team. Amanda.
Hi, Cheyenne. Welcome to our outpatient neuro gym, where we see our patients with neurological and vestibular conditions. We have the weighing device, which consists of a harness that allows us to provide body weight supported weight training for our patients who present with walking difficulties. We have a machine here, which allows us to build up the cardiovascular function of our patients with neurological conditions. It is interactive as well, providing patients with the necessary feedback on how they are performing. Here you see customized markings on the floor. The purpose for this is to allow us to conduct objective outcome measures which assesses patients' mobility, balance, and fall rates. In addition to the marked-out distances, the rest of the blue lines serve as visual cues for patients with Parkinson's disease who shuffle.
Hi there, I'm Tracy. I treat patients with vestibular conditions which often present with dizziness and balance problems.
Frontal goggle helps us to magnify the image of the eye so that we can better spot any abnormalities of eye movements.
Here we have a posturography machine where we feature patients who have balance deficits.
Under different conditions, this equipment will analyze the different systems that is required for our standing balance.
The Pulmonary Rehabilitation Program provides education, exercise, and support to patients with pulmonary conditions. Let's meet Sophia who will tell us more.
Hey Sophia. Hi Cheyenne. Alright, so welcome to the Pulmonary Chest Clinic. We specialize in seeing patients with chronic lung diseases and other respiratory conditions. We teach airway clearance techniques to patients who have difficulty clearing their secretions or other breathing exercises to improve their lung volume or manage their shortness of breath. For patients who have reduced effort tolerance, we will advise on an individualized exercise program. Assessments such as a 6-minute walk test and a 1-minute sit-to-stand test will be done to assess the patient's aerobic capacity and endurance at the beginning and at the end of the exercise program. PRP is a 10-week exercise program that includes exercise training and education talks to improve the physical and psychological condition of people with chronic respiratory disease. Telerehabilitation is a relatively new program that was started in order to deliver rehabilitation services through telecommunication, allowing patients to undergo an exercise session supervised from the comfort of their own home.
We're now at the Rehabilitation Centre at the SingHealth Tower. Here we manage a spectrum of musculoskeletal conditions and orthopedic surgical cases. Without further ado, let's meet the team. Hey Kenneth.
Hi Cheyenne, welcome. Let me tell you more about the pain clinic that we have here in SGH. In our chronic pain clinic, our physiotherapists work hand in hand with the pain medicine doctors as well as other healthcare professionals such as a psychologist to guide and empower our patients through a series of interventions ranging from patient education to exercise and different types of movement in order for patients to better manage their pain.
Hi, my name is John. Welcome to the North Gym, where we see patients who have undergone knee replacement surgery. Patients have access to a wide variety of exercise equipment. We also have rehab equipment designed especially to improve flexibility of joints and to stretch soft tissue. We monitor our patients closely by performing outcome measures regularly to ensure that their recovery is on track.
Hi, I am Yijin, a senior physiotherapist who is part of a specialized team to care for patients who have undergone their shoulder surgery. We would do strength and conditioning to facilitate patients' return to function and eventually back to their sporting goal. We monitor their progress closely with patient-reported outcome measures and other objective measurements such as measurement of their shoulder range of motion, short put test, and upper quarter Y balance test.
Hello, my name is Shin Yin. I'm part of the Physiotherapy Spine Service team. We provide individualized treatment for patients with different spinal conditions such as neck and back pain, scoliosis, as well as patients after post-spinal surgery.
Hello everybody, my name is Fen Ru. I'm a senior physiotherapist and I am a part of the sports physiotherapy team. We are at the sports rehabilitation gym and running track. The sports physiotherapy service uses a team-based approach to help manage sporting and active populations with sports injuries. Let me show you around.
The outpatient rehabilitation gym also houses our very own Life team. Life stands for Lifestyle Improvement, Fitness Enhancement. Let's meet Cindy who will tell us more. Hi Cindy.
Hi. This is where the Life team works. We basically do assessments as well as prescribe exercise based on the profile of the patients that comes to us. So we deal with multiple comorbidities, and what we look for is actually managing the patient as a whole.
And we have one last stop before we go over to meet our colleagues in the wards, and I can't wait for you to meet our very own pelvic health physiotherapists. Hey Alicia.
Hi Sharon, come in. Here in our pelvic health clinic, we specialize in helping ladies and men with pelvic floor muscle dysfunction. Such dysfunction can occur as leaking of urine, stool, or even be known as incontinence. Patients often find our education and exercise useful in managing their symptoms. In our clinic, we often use the ultrasound machine to let patients see how well their muscles move or how much urine left in the bladder. A urine pen may also be used to track the amount of pee.
At the 64 inpatient gym, we see a variety of patients from different subspecialties for rehabilitation. This includes the geriatric, inpatient neurological and pulmonary populations. We have exercise and assistive equipment to optimize rehabilitations for patients who require more assistance.
Did you know that we also have another inpatient rehabilitation gym? Let's head over to meet Dora.
Welcome to 76 Rehabilitation Centre.
This is where we see our post-op orthopedic patients, such as those with total hip and total knee replacements, or after knee scope surgeries, or foot and ankle surgeries. Patients can also see others who have gone through similar surgeries doing their exercises and undergoing rehab next to them. We run patients through their post-op exercises as well as teach them how to walk with appropriate walking aids and climb the stairs.
The neonatal and pediatrics physiotherapy for the infants starts from the early days in the neonatal ICU and extend to outpatient pediatrics clinic. When the premature infants are in the neonatal ICU, physiotherapists work closely with our neonatologists, nurses, speech therapists, and medical social worker to help infants who are at high risk of motor developmental problems to initiate early intervention. Physiotherapy intervention includes neonatal developmental care, positioning, stimulation activities, and most importantly, early parental education. This is the Pediatrics Physiotherapy Clinic. We provide services such as neurodevelopmental assessment, pediatrics rehabilitation, and age-appropriate activities to help children with movement problems. The patient population that we see includes infants and children with neurodevelopmental concerns and musculoskeletal problems. The role of the physiotherapist is also to educate parents on the home program exercises for their children. The physiotherapist will then assist the children to transit into the community for further intervention program whenever needed.
We are currently at the Burn Center and we have Wei Xiang with us who will tell us more about what goes on around here.
Singapore General Hospital houses the most comprehensive burn centre in Southeast Asia. Our physiotherapists work closely with all the other healthcare professionals such as the doctors, nurses, occupational therapists, dietitians, and medical social workers amongst others. In the acute phase, physiotherapy for cardiopulmonary care is crucial, particularly for those who have sustained inhalational injuries with smoking history and history of respiratory conditions. Physiotherapy interventions include range of motion, stretching exercises, mobilization out of bed, gait and functional training in preparation for discharge. Re-entering the workforce is a significant and pivotal goal for injured workers, particularly for burn survivors. Burn rehabilitation in the outpatient setting includes management of complications from burn scarring, functional activities training and progression of therapeutic exercises and stretches. As part of the hospital's return to work service, we often involve burn survivors beyond rehabilitation to provide coordination efforts with the workplace and guide injured workers towards return to work.
It has been 75 years of making a difference in patients' lives since the establishment of our Physiotherapy Department in 1947. With that, we've come to the end of our virtual tour. Thank you for joining us. Bye!